Is that a meeting? All right, Judge, go ahead.
Okay, I'd like to welcome everybody here tonight to the county courthouse. Several reasons for us to come here tonight. Number one is to let the folks of Limestone County know that we are not just sitting around watching the proceedings that are taking place. We've got a lot of folks working hard. There's a lot of things that have been happening in Limestone County kind of behind the scenes. And I thought it was all important that we get together and open it up for questions, especially after the executive order from the governor today. Let me start off by saying first that Limestone County has 0 confirmed cases right now. I believe that they are currently testing a couple, but right now 0 confirmed cases. Some of the things that are happening in Limestone County that were disappointing over the last few days, and I can tell you right now that what's happening is things are being multiplied every day. Whereas Monday, we were thinking possibly that we could even have a county fair, maybe a county fair of some type that would be modified. And by the time last night got here, it was almost impossible to have that. And then, of course, today with the executive order, certainly could not have it. And so I want to first and foremost thank the Limestone County Fair Association Board. Those people worked as hard as anyone I've ever seen to try to do this for the kids. I am asking that everyone here tonight and everyone listening at home will do what they can to help these children out, but they're going to have something come up to where they're going to try to help these kids out. That's something that was near and dear to my heart. I tried to get it to work, I just couldn't make it work. So just to let you know, I tip my hat to those Limestone County Fair folks, the board of directors, because they worked every night till about midnight trying to make this thing happen. Today, of course, most of you know, and if you don't know, I'll tell you real quick what it's about. And we're getting a lot of questions from different people. I've had questions all day for the last 2 or 3 days as far as what we can and can't do. Whether it be, can we have a funeral, all the way to, can we eat, within restaurants. And of course, with today's decision by the governor, if you're not familiar with it, the governor stated today that starting, I believe it's tomorrow night, there'll be no more than 10 folks allowed to be gathered together at any spot. And the social distance that you keep hearing people talk about is trying to keep folks further away. And frankly speaking, we won't even have a meeting like we're having tonight after tomorrow. The main thing locally, and the thing that affects a lot of people, is this about the restaurants. And in accordance with the guidelines from the president and the CDC, the people shall avoid eating or drinking at bars, restaurants, and food courts, or visiting gyms, massage parlors, provided, however, that the use of the drive-through pickup and delivery options is allowed and highly encouraged throughout the limited duration of this executive order. Now, keep in mind, the governor spoke many, many times about how important it was that the food industry stay open. And those of you that were listening and have been listening to the calls that we've listened to for the last few days, he wanted to make sure, and just to give you an example, one of the callers called in, I believe it was last night. Just an example, could someone walk into a donut shop and get a donut? Yes, you can walk in and get the donut, but you got to take it, pay for it, and then walk out. So for the folks that are worried about, can my restaurant stay open? Yes, it can stay open. Can you have people come in and seat? No. Unfortunately, that's something for the time being that we cannot do. And I know there may be some questions about that, and some of you here may want to talk about it. The thing that bothers me and scares me the most on that, not the most, but one of the things that bothers me, is the impact that it'll have on our economic environment. With these folks not being able to open, just how many folks are gonna be temporarily, without jobs. Very concerning, and something that we will be continuing to look at and look for the state as well as the, federal government to help us on that, if at all possible. Of course, another big issue that was hard to swallow, hard to understand, is the fact that you will not be able to go see your loved ones in a nursing home. A friend of mine today said he was going to have to take his mother to a nursing home, and I know when that first happens from experience, you want to be there as much as you can for them and help them get comfortable. But unfortunately, for now, in the temporary, we can't do that. And that's not something that they're suggesting. These are mandates that we have to follow. The last order that was given today is the fact that the schools will be temporarily closed until such time. And we do have some superintendents here from the different schools that might be able to address that. But and so I have to tell you that my personal belief is that we don't want people to think that, and I've said this many times, that the coronavirus is not a death sentence, but it could be. There may be people sitting here tonight that have it. There may be 500 people in Limestone County that has the actual virus and will never get any symptoms of it. And we would never know this. Where we would know it is when by accidental spreading to someone that is vulnerable, and they could get this disease and then they couldn't make it through it. Whereas we hope that the majority of folks can. So the bottom line is that we're going to ask you to please stay at home. If you can, stay at home. If you have to work, let's work. If you can lay folks off for a while, we're going to ask that you do that. I know here at the courthouse, I've talked to most of the elected officials here and give them the option what we can do and can't do as far as taking some time off. With that being said, I'm going to turn it over to Matt Groveton. Matt's the emergency management coordinator. Matt kind of he's really stayed involved in this. I don't even know if he's done anything but this for the last week or so. But and so I'd like to turn it over to him, and he'll continue the program. But once again, for Limestone County, feel comfortable that we're doing what we can to whatever limit that is. And there's a lot of folks here very concerned about you. So that, Matt Groveton.
Judge, in the interest of time, I know some people need to get out of here. I'm going to defer what little I had to say. You covered it, and let's go ahead and start going around the room.
Okay. And you, Matt, the idea of having just a round table.
Whatever they want to talk about.
All right. Anybody here have something they'd like to visit about or run with that? Jerry? If not, let's pass it on.
There is one thing that the governor spoke about in his message this morning, and that was, and I'm asking the other mayors, because you're the ones involved, what are we going to do with our May 2nd elections? He gave us the option of postponing them until November. But it is left up to us. Now, tomorrow may be a different story. It may be a mandate, because that's the way this has kind of gone, that we don't have it. But right now, what are your thoughts as far as the local elections?
Well, and also, do we have a contested race at the high school? We don't have one there. What about Rosebeck? I don't know if I probably had a chance to talk here.
Goes back to, we're not gonna have a May election
Airlines
because
on.
all the incumbents were, challenges, right?
Okay. I know that, the city in my head, there would be a race. Yes, sir.
Are you going to have it, or are you going to postpone it?
Mayor and I have been talking about that. I think we still got a little time.
Well, that's what we felt like in talking, because we do have some contested races. And we felt like we were just go along a little further and see how this thing developed, and then try to make a decision.
The main thing for the city of Rosebeck is for everybody to know that we are open for business.
We're still policing. We're still giving, doing water services. Public Works is still up and running. Our city park is still open. We haven't closed ours yet. Our convention center will likely be closed. We have not enacted any ordinances. We fell under Governor Abbott's ordinance, our executive order today. But like I said, the police, we're still out there. We may be a little more selective on our lower level, traffic enforcement as far as everything else goes. We've lined up how we're gonna respond to calls for service, how we're gonna interact with people, but we are still up and running 100%. So the city is not shut down.
Hi, I'm Eric Gary. I'm the city manager for the city of Mahia. I just want to say, we did put the governor's order up on our City of Mahia website at cityofmahia.com. We also have the ordinance that was previously passed by the city council and some additional good information there on the virus and the actions that we're taking. So that's for the public, that's cityofmahia.com, City of Mahia all run together. The only thing I'd like to add, Judge, is from your office and from Matt's office, the support that the city's received from the county throughout all this has just been tremendous. We really appreciate it. We're communicating together, working together, all for the benefit of everyone in Limestone County, and we really appreciate it.
I'm Dr. Lyle Demise from Mahia ISD. Per the government's proclamation, all school districts in the state of Texas will be closed till April 3rd. At Mahia ISD, we're very excited that we're being able to offer our food service during lunch from 11 to 1 for all students who are age 0 to 18. Today, we served over 600 meals, and that was doubled from yesterday. So any of our Mahias, any student in the area, age 0 to 18 who needs food can come on up to Sims from 11 to 1 and pick up some food.
You know, I went to a eye appointment on Tuesday, and when I was sitting there, I was talking to the doctor, and I asked her the question, are you going to remain open? And she said, you know, we've been talking about closing, but I feel like we have a moral obligation to stay open and serve kids or serve our patients. We feel that way in Coolidge, and I know Lyle and James does in Groesbeck. So I actually typed a letter this morning saying we were going to, on Monday, start not being in school. We spent the better part of the day coming up with instruction plans, meal plans, as well as plans that if we have a parent who doesn't have the ability to stay home with a kid, came up with a babysitting list to where we could provide those services for the kids and the parents, because a large part of our parents were labor force employees. And if they don't go to school, they don't get paid. So we want to make sure that those parents can continue to go to school. So, but again, it's our moral obligation to take care of our kids and educate them and make sure they get fed.
Judge, I've got Dr. Crowley, who we had one appointment. He's calling in right now. Doctor, go right ahead. You wanted to say something about the elections, I think so.
Yes, that'd be fine. Good evening, everyone. As Matt said, my name is James Cowell, and I have the privilege of serving as the superintendent of Groesbeck ISD.
Good afternoon, Dr. Crowley.
Go ahead, sir.
Okay. Good evening, everyone. My name is James Cowell, and I have the privilege of serving as the superintendent of Groesbeck ISD. I apologize for not being able to be at the meeting tonight, but I did have a previous appointment for me to leave at this point in time. Let me give some information concerning Groesbeck. Just as Dr. Lowry said, and Dr. Buse, the decision to close the Groesbeck school campuses was not taken lightly, and one that I hoped I never would need to make. I'd like to explain to you our take on this situation the best I can, and I realize not everyone will agree with our way of thinking, but at least you know where we are coming from. Currently, I am listening to a conference call from the Commissioner of Education every day at 3 p.m., just as many superintendents are throughout the state. I've also had several direct conversations with surrounding superintendents, school board members, multiple conversations with county officials, guidance from TEA, and guidance from health organizations. Our stance at this point is we are trying to help the greater good of our community and protect our students and staff. And at this point, all Groesbeck ISD campuses will be closed to students through Friday, April 3rd, just as the others have said, due to the executive order by the governor. The administrative team of GISD will meet on Sunday, April 5th to make further decisions on whether to reopen campuses on April 6th. By this time, all of our parents should have had contact with their child's teacher. If not, if they would please send an email to the campus principal, since instructional support is being provided for our students for all classes. Teachers are going to continue to be making contact with students through electronic and paper methods to provide that instructional support. And we've been notified from the Texas Education Agency that we need to continue to have our parents verify the instructions taking place. We may be getting additional guidance on that, and that may change. Based on our current information from the Texas Education Agency, because we are providing instructional support to our students, GISD will be able to request a waiver that we do not have to make up missed school days. And it is very important for students to complete the assignments in order for the grades to be received in course credit. I've received many questions about our seniors and graduation. I want to assure the parents and the seniors who complete and return their assignments that they're going to receive the grades and credits that they will graduate. At this time, Groesbeck is committed to providing a graduation ceremony for our students. We cannot answer exactly how this will take place, but we're going to continue to monitor the situation and make the best decision to honor the hard work of our students while also protecting them, their families, and our communities. Just as the other districts are doing, we are providing food services. We have a drop-off location in Cossie, in Thornton, at the XTO building. That one has not been very successful, so we'll be moving into the Lake Limestone store and at our H.O. Whitehurst elementary campuses. And those times will be changing to once a day feeding beginning on Monday from 11 to 1. To answer the question concerning the election, we had an emergency board meeting today, and our board of trustees made the very difficult decision, and it was much discussion, and I will tell you a very, very difficult decision, but they did decide in order school board election to the November general election. We do have 4 individuals running for the board, and so that election will occur in November. We all wish we had greater opportunity to be able to make that decision at a later time, but the Secretary of State, through their guidance, stated that we had to notify them by Friday what the decision of the district was. As a final note, Groesbeck ISD has the distinction of being the only place in the United States that uses the goat as our mascot. As you look at that, goats can climb, walk, and find their way through rocky places using their strength and agility. I truly believe our Groesbeck goats will do the same thing as we work through this rocky time in our state and nation's history. Thank you.
But Cal, if you would sort of try to hang with us a little while, I know your phone is breaking up. We might have a question, we might not. Could you hang with us a couple of more minutes?
Yes, Matt, I did send you a phone number that you can call that may provide a stronger signal.
Okay, thank you very much. Let me just say you can email in your questions at limestonecv322@gmail.com. Dr. Lowry, you never introduced yourself. You might tell them who's talking.
My name is Robert Lowry. I'm the superintendent of Coolidge ISD.
My name is Jesse Ashmore, and I'm the mayor of Coolidge, and I'm learning a lot from y'all, and we're having a special council meeting tomorrow to discuss just that in the elections, but since he informed me we have to tell the state what we're gonna do before then, I guess I'm not sure what we're gonna do, but we'll just have to see, in that one. All of our activities in Coolidge, they've been put on hold. The Tea Tree Festival, we're gonna play that by ear. Civic Center, they have a lot of stuff going on down there. We're not doing that. But one question I was wondering was, we have senior citizens, they eat there every day, and I haven't talked to them. I'm not sure what to say, but there's quite a few that come in there and eat.
I talked with, just to let you know, as far as the senior citizens, centers, I believe, and please understand, the senior citizens are funded by Limestone County. They're subsidized by Limestone County as they are by Groesbeck and Mexia. But they make their own decisions. Their recommendations from TAC is that they close because they won't be able to have that many people in there eating. And from what I'm hearing from some of the senior citizen centers is that I don't know if it's the families or what, but the participation has really gone down a whole lot in fear of the older generation maybe catching something. But I anticipate in the near future that they're gonna close those actual dining part of it. The meals will still be taken out, delivered, so that's not a question, but to have folks coming in and eating, based on what I heard today from, Texas Association of Counties who does that for us, that's gonna probably be very close.
One other question I have, we have a little store there, gasoline and everything. And I'm not really concerned, but there's a lot of people stop there from out of town, go in there, they have food there that they get, so I don't know if we have anything to do with that or not, but,
You, actually, it's a convenience store,
right.
and a lot of them, for instance, I know in my head, there's a Charlie Allen's, makes a fantastic hamburger, I love it. But they closed today just on their own. They're not being required to close. You can go in there, get a hamburger and leave. You can't go in there and sit down. And I anticipate that's gonna be the same with your store.
Okay.
They can certainly go in there, order whatever food they can get, but then they have to.
Well, we have one barbecue place, and Quality talked to him, and he's either delivering or they're coming and getting it.
Absolutely.
And that's all I have.
I'm Maria Gordy, I'm the mayor of Rosebeck, and we have been working on this problem since it first started. We didn't have any solutions then, we don't have any solutions now, but we've already took action with the schools and with the restaurants, and we're trying to employ the same warnings and techniques that the governor is recommending. Yesterday morning was having my breakfast, there was the majority leader, the minority leader of the Senate was on TV talking about how they call in the national, try to get the president should call in the National Guard and start putting up tent hospitals and so forth. It came to me that one of our sister cities here, Marlin, had a 300-bed hospital sitting there empty that just belonged to the VA and just recently had been passed to a private enterprise. So I called our representative, Kyle Cassell, talked to him, and he said he was aware of that. He's the one that told me also that it had been sold to civilians, but in a time of emergency, the state can take over those facilities and use them as they need to. My grandson, I bought him a new truck. I went to McKinney here about a week ago, and we got the price of the truck, the best in the state, so I said, well, why don't we just spend the money here in Limestone County? And he went to one of the dealers in Mahia, no success, so we went to match the price, so we went and got it. The reason I'm telling you this story is because yesterday morning, he went to out to West Texas. He works in the oil field out there for sand fracking.
That's our mayor of Rosebeck.
Anyway, when he got there, his person in charge out there could not breathe, so he went to the hospital, and he's now being held, and they're testing him for the virus. And I understand he's on his way home, so evidently he must have got positive results. He's on his way back home. And so I don't know what his contact was with his boss out there, but I'm gonna find out when I get here. We're gonna put him in isolation until we find that he's not involved. This is something we're gonna have to face here, because people working in these far places are coming home, they're gonna, whatever contamination they got out there, they're gonna bring it right here to Rosebeck. So we just have to play it day by day. We went to a meeting with Dr. Crowley earlier. As I said, we've been working on this, and he's got a handle on the school situation in Rosebeck. we went to a meeting today at the, hospital. We went over some of the same things you're probably gonna go on here. We, were on the governor's, we listened to the governor's, task force last night, or yesterday after the evening, and we're here. We're ready to help in any way we can. And, I'm gonna pass the phone on to the speakers, the next guy here.
Thank you. Bob Honeycutt, CEO at Parkview Regional Hospital. Just a couple quick comments. Obviously, we're in unsettling times throughout the county and throughout the state, throughout the nation, actually. Just to let you know, Parkview's role is really helps slow the spread and minimize the impact of the COVID-19 virus, and we're working very hard to make that happen. I know Larry and his team at Limestone Medical Center is doing that as well. Just to tell you a little bit of the things that we've done to help mitigate the spread of the disease, or the virus, I should say, excuse me, is that we have limited access to our hospital through one door, which is located by our med-surg unit and our ambulatory ER door. Everybody that comes into the hospital is being screened per CDC and the state of Texas declarations, as well as the Texas Department of Health. That's all employees, all physicians, all visitors, all patients. And we're doing that so that we can make sure that we have appropriate plans of detection in place. And then also that if we do get a positive result, then we can protect and respond appropriately to those individuals that have contracted the COVID-19 virus. At this time, we've all mentioned this, but I do want to reach out and say thank you to all the employees at Parkview and to Limestone Medical Center as well for all their dedication to coming to the hospital every day, taking care of our patients and performing these screenings is very, very important. And we see that as our role as community assets, not only to our individual cities, but to the county as well. And then, of course, we understand that these increased precautions really seem concerning, but we don't want you to have a cause of alarm because of this. But we do, however, want to make sure that we send a very clear message to our communities that we're responding appropriately and are committed to protecting the well-being of our patients, visitors, employees, physicians, and our community members. And lastly, as a reminder, I do want to let you know that these increased safety measures do not mean that you cannot access the hospital or your local providers. We're open for business. Again, we're screening all individuals coming through Parkview, and we want to encourage all those that need care to seek care out, either through your primary care physicians or through the hospital, and we'll do everything we can to make sure that you get the care that you need, which is appropriate and timely, and we'll be glad to take care of you because we see that as our right and our privilege to do so for Mexia and Limestone County. So,
thank you. I'm Gary Smith, Mayor of Mexia. I just want to repeat what Judge Duncan said. I want to truly appreciate the support we've been getting from federal, state, and local governments. I want to stress and thank our city manager, Eric Garrity, our local police and fire departments has truly been jumping ahead of the game. I'm sure this is an adaptive type situation we have, and as things change, we change. Constantly getting calls from Eric, hey, we need to address this, we need to do this. And I really want to thank our city council. I don't think it's been any wavering or any debates when it comes to the safety and well-being of our citizens of Mexia. And I think it truly boils down to personal responsibility, getting a hold on this. And I truly feel confident that as things change, we'll rise to the level and truly address this situation.
Good evening. My name is Dennis Wilson. I'm the sheriff here in Limestone County. We've kind of been out at the sheriff's office in front of this for about the last 3 weeks. I monitor daily the governor's website and information that passed on to the governor's office and the precautions and alarms and alerts that we should be looking for locally. I too want to echo what the mayor said and Mr. Kinsa said. That I want to know the law enforcement stands behind our healthcare people 1,000%. We talk about the dangers that we face out on the streets every day when we stop traffic and the people that we confront. And you guys don't have a defense because they walk in your hospitals and they walk in your clinics and you don't know where the last one came from or where the next one's coming from. So for the people in healthcare, we want to know the law enforcement totally 1,000% behind you and support you. Also, I'd like to let you know that, from the criminal justice side, as you know, we run the county jail here, and I fall under the Texas Commission on Jail Standards, and there's a number of rules and regulations that I have to abide by because of the standards that are put forth through the state of Texas. They have relaxed some of those standards, so they're giving us a little breathing room on some of the things we can do. I will tell you this, that my guys and gals on the street and my guys and gals that work in the county jail and those that work in dispatch, we're totally unprotected. We don't have any of the medical masks and the gowns and all that. You know, we have gloves, but that's it. But I'm telling you that we have put into place today, we've closed down visitation in the county jail. We're not allowing that to happen, and we get relief from the state for that. One of the things that we did do, because the ACLU put out a rather strong memo this morning about those that are incarcerated in our jails, and one of the things that we're offering is we're trying to get our phone company to allow them to have additional free phones. So we're trying to get 3 calls extra that's free, and we also will provide them out of our inmate commissary fund additional indigent paper, stamp, pencils if they need, if they can't afford. Under the regular rules, they have to have money on their commissary account before they would qualify for that. And we're waiving that internally to try to address the issues that the ACLU did. As far as the county jail operation effective this afternoon, we're not going to accept anyone else that are brought in on misdemeanors with the exception of DWI offenses, family violence offenses, evading, and fleeing. We'll take those. But anything else, we're telling you to sign release, or we're asking you to sign release, or we're asking you to put your case together and let us get through this turmoil or crisis, and we can always go back and file your case. I've been in constant contact with our district attorney, Roy DeFriend, so we're all on the same page with that. Today we went through our misdemeanor population, and we released the misdemeanors that were in our county jail that we could safely. And that only applied to the misdemeanors. I think there were 2 that we came up with out of the group of misdemeanors we had. So that's it. We're telling our deputies on traffic stops, if you are there trying to traffic stop, to try to have limited contact with the violator. We don't want to, I'm not saying we're not working traffic, but we are. We're trying to refrain from that and have limited contact. On the calls that come into dispatch that we can handle from the telephone, but the deputies are going to handle it from the telephone without having to go out and make a one-on-one contact, in-person visit with you. If it requires us to go in the hall or wherever, obviously we're going to do that. So I can just tell you that there's a number of, as far as the information that's flowing back and forth, both at the federal and state level that I get through my office, I monitor it hourly, and my staff and I are continuing to talk to each other. We're here to support the citizens of Limestone County 1,000%. We're going to do everything we can do in our power to be that. We are going to be a team player. And we want to know wherever the problem is, Coolidge, Wortham, not Wortham, that's in Freestone, but Coolidge, Thornton, Cossie, wherever it is, Mahat, if there's a need for the sheriff's office, we're going to be there for spring. So thank you.
Thanks, Sheriff. Let me go ahead now and say that we've got some other folks here that might want to maybe. We didn't have enough chairs for you, but we do have the Mayor of Casa here, Jared Eno. And then, Mayor, do you want to say anything? Do you have anything that you'd like to address? Sure. Okay, please come up and.
Jared Eno, Mayor of Casa. We have followed pretty much the same recommendations and things that most of the other cities have done. The city council today held an emergency meeting and declared a state of emergency, and we've implemented several initiatives throughout the city that will be taking place or over the next day or so as we get around to it. The mainly though affecting our residents is the limitations on restaurants, like you talked about, they will be takeout only. And limitations on gathering. I think 10 people we decided was the limit on that kind of stuff. So other than that, the city staff and our resources have been mobilizing just like everybody else's, and we feel like we're ready to handle whatever's thrown at us.
Very much. Roy, do you have anything you want to say? At this time, I'm going to turn it over to Larry. He's going to introduce a couple of folks that want to say just a few things. So Larry?
Yes, I have two of my infection preventionist nurses here tonight, Corey Tunnel and Heather Flippin. Mike, do you want to come up and add on anything about our supplies and things at the hospital? What all we have, how we're screening our patients? I thought they would be the best to address this because they are on the front lines for us. So,
Good evening. Again, my name is Corey Tunnel, and I'm one of the infection preventionists from Limestone Medical Center. We also oversee 3 of our clinics, Family Medicine Center, Reddick Family Healthcare, and the Cossey Community Health Center. We have been preparing diligently for several weeks now. We have pushed screening into place as early as about 3 weeks ago. We have started moving in measures and kind of upping those barriers, and we have closed all of our entrances to the hospital except for our main entrance and our ER entrance. We did that for screening purposes, again, like Mr. Honeycutt said, so we could have an idea of what kind of exposure and what's coming into our hospital, keep our patients, our community members, and our staff safe. Excuse me. We have moved, as of this past week, to daily meetings with a specialized team. We try to talk about potential issues that could arise so that we are prepared for anything that comes at us. We have also prepared to provide testing as early as last week. We have testing available to patients that are concerned that they could be infected with the virus through our commercial laboratory, which is separate from the traditional route, which goes to the Department of State Health Services. That actually cuts down time for diagnosis and testing for our patients. Let's see, what else? I'll turn it over to Mike now.
I appreciate it. My job at the hospital, of course, is supplies, also emergency management for the hospital. And we've been working diligently trying to find supplies. Now, that is one area where we are having difficulties, and I'll admit to it. We are limited, and I'm sure you had the same problems we're having. We have put measures in place to make these supplies last as long as we can. And of course, I hope between now and then I can get my hands on additional supplies that will build up what we need. These 2 ladies right here have been doing an excellent job. I'm impressed, very impressed, and I'm sure Larry is. We did a drill today, and in the drill, we uncovered some weak spots. But these weak spots we're going to take and we're going to build on them and become stronger. And we will be here to help you when you need help, and we're here for the community.
Hi, I'm Heather Flippin. I'm the other infection preventionist at Limestone Medical Center. Just want to let you know that Corey and I work with reportable illnesses on a daily basis. So this is kind of yes, this is a new bird for us, but this is something that we are used to. We have contact with the health department on a daily basis. They're very, very good at helping us. We go by the guidelines. And I just wanted to report the latest numbers and the information where we can get that. So the confirmed cases are going to be on the DSHS website. And it had been updated, it's updated daily. Last update was there were 2,335 people that were tested. There was 143 people that tested positive in Texas, and there were 3 deaths. Also, the CDC had put out the age ranges of those that were affected. The mortality rate of that, which would be the death rate, is 85, greater than 85, 10 to 27% was affected. Ages 65 to 84, 3% to 11% was affected. Ages 55 to 64, 1 to 3% were affected. And age 20 to 54, less than 1%, and there were no fatalities among persons aged 19 or less. CDC is updating it very closely, as well as the DSHS, and we are really, when we're doing these screenings, we're really concerned about community spread. Because if it's spread in the community, then they're going to be more likely to be infected. So when we're asking these screenings, because it's global now and it's spread 4 states that's been confirmed. That is Illinois, Washington State, New York, and California. Because we have people that say, well, yeah, I've been to Dallas, well, Dallas has 20 cases, so they're concerned, and they should be concerned. So education is key here. We don't want to cause any panic, and we want to be very well informed. So thank you very much.
Judge, can I mention the email address one more time?
Yes, please.
If you'd like to email, you better hurry, because we haven't got a single one, which doesn't surprise me. But it's limestone cv322@gmail.com.
Is there anyone else here tonight, while we're waiting on these emails to start coming in, that would like to address, the people of Limestone County, maybe, of your city, but I think this is pretty much Limestone County. Anybody else here? You know, one of the first things that I was told, and I put this in a little blurb that I put out, was that, we were originally told, to be worried, but not to worry. I didn't really understand that. However, if we can, you know, there's several times I say, well, what can I do? What can I do? Well, I was able to spend 3 months in Marine Corps boot camp. I didn't think I could do it, but I did it. We're asking you to spend a couple of weeks of really battening down the hatchet, if you will, and really, really try to do the social distancing that we're asking you to do. That's basically about it. We can make it work, ladies and gentlemen, and let's just see if we can take, number one, let me just say something else. When this first started, I thought, well, this is nothing. This is good. We're done. And that was on a certain day. The next day, it was 2-fold. The next day, it was 10-fold. The next day, it was 100-fold. Now, so you see how it's growing. And that's the reason of the concern. We want to do what we can, but as Mike was telling us earlier, and as the gentleman from Parkview was telling us, we're doing all that I know that we can. We'd love for you to ask us some questions, if you have any. Matt, if we got any at all. We do have the Fire Chief from Mexia, Rob LaFoy, that would like to speak. And so, Rob.
Thank you. Robert LaFoy with Mexia Fire and EMS. Sheriff, if you don't mind, I've got a question for you, please. We have we haven't heard if Communication Center is asking questions and screening 911 callers for the EMS. Can you elaborate any on that?
They'll be asking those questions when they take a call in, because that's been given dispatch.
Okay. I have noticed they're giving us that information. I was just wondering if
When it first came down, I made a call to Mike Halton at LMC to find out exactly what question that you guys wanted to ask from the ambulance crews.
Yes, sir.
And Mike said he got with you. And we came up with some questions, or y'all came up with some questions. Those questions were delivered to dispatch communications, and that's supposed to be the protocol they're following down dispatch. I checked with my dispatcher supervisor yesterday afternoon, and she said there's been no issues, and I'm assuming that they're following what we put in.
It sounds like they're doing great. I just wanted to confirm that. I had no knowledge of that. I appreciate it.
That y'all are wanting to use when it is.
We don't do.
There is no code. He's just.
So you don't say, we don't do code.
Right. They're just telling us they do or do not have a fever, do or do not have a cough, and such.
Yeah, and to add to that, you know, we're going through a training curve.
Yes, sir.
So that's stressful for that, trying to put the trainer and get the trainees on board. So it's a little stressful in there right now, but I think they're doing a great job.
I do too. Thank you.
Anybody else that would like to address the folks of Limestone County? Want to, again, thank y'all for coming out on a Thursday afternoon. Yeah.
The one thing I want to ask the other cities while Matt's here. Did you want to clarify that even though Governor Abbott issued his executive order today, that the cities who have not declared a disaster should still do that and submit those to you, right?
That is correct.
Okay. So the city of Groesbeck, we have not done ours, I'll have it drafted tonight for the mayor.
The governor did that straight away. First of all, he declared a disaster for every county in the state of Texas, but it would be better to make sure, because whether there's money for reimbursement when all this is over, I don't know. But go ahead and declare that emergency, and that way we'll be sure.
And I know Limestone County is going to be doing the same. We're getting the draft right as we speak. We're working on it today. Anything else, man? Do you have anything else that you'd like to talk about? If not, then, I'd like to once again thank you. We can do this, ladies and gentlemen. And, in closing, Dr. Crowley talked about, how strong a goat is. I can tell you right now that there's some black cats that are strong. There's some yellow jackets that are strong. I know there's some tigers that are strong. And, anyway, I just want to, say good luck to everybody and, let's make this happen. Thank you.
Thank you, Chris. Appreciate you helping us with that.
For the most part, it was,